West Virginia has historically been the leading state in the nation for its drug overdose mortality rate. 7 News reporter Bailey Martin has recent reports from the Center for Disease Control on the impact that 1 year had on overdose deaths in the United States. And she is live in the studio now. Bailey.
The CDC has released a new vital signs report addressing the significant notable increase in drug overdose deaths around the nation, spanning from 2019 to 2020. Unfortunately, the trend line is continually sloping upwards, but there are actions being taken by the CDC and locally to change that.
1 year. That is all the time it took for a historic increase in drug overdoses across the United States. Through the monumental time period of 2019 to 2020, there has been a 30% increase in overdose deaths throughout the nation. Last year, West Virginia was in the lead for the number of fatal drug overdoses. Of the 1,275 fatal overdoses, 955 involved fentanyl. Jamie Evick, Vice President of Medical Affairs at Reynolds Memorial Hospital, says that there has been an increase in patients coming in for overdoses, as well as seeking treatments through their breakthrough program.
There's several reasons that this happens. Opiates is one of the biggest abused drugs. What we're seeing is fentanyl, which is manufactured, is much easier and much cheaper to make. So they're mixing the fentanyl with other drugs. So it's becoming more lethal because the fentanyl is more toxic at smaller doses.
The CDC has just released a 2022 vital signs report documenting the overdose deaths by race and ethnicity between 2019 to 2020. In 1 year, overdose deaths rate most notably increased 44% for Black people, 39% for American Indian and Alaskan Native people, and 24% for white people. The CDC Acting Principal Deputy Director Dr. Deborah Owery responds to these numbers by stating, quote, "The increase in overdose deaths and widening disparities are alarming. Overdose deaths are preventable, and we must redouble our efforts to make overdose prevention a priority. Providing tailored tools and resources to combat overdose and address underlying risk factors will ultimately help reduce health disparities and save lives," end quote. Jamie says the breakthrough program at Reynolds Memorial Hospital, a 3-day controlled inpatient stay, not only assists those withdrawing, but their families as well.
Become, involved with the family, with the patient. And our concern is what can we do after they're medically stable to prevent this from happening again. So a lot of times we'll involve behavioral health, we'll get the breakthrough program involved, and we'll make sure that they're set up for outpatient follow-up on discharge.
If you or someone close to you needs help for a substance use disorder, talk to your doctor or call SAMHSA's National Helpline at 1-800-662-HELP at the bottom of your screen, or go to their website for more information. Live in the studio for 7 News, I'm Bailey Martin, working for you.